All right, welcome everyone to tonight's webinar. We brought Susan Leckowicz on to give us all of the knowledge and wisdom of how to handle patient phone calls. Yes?
Yes, yes, that's what
Yes.
we're going to talk
Okay.
about. Excited
Um,
about it.
so I'm gonna hand the time over to Susan for just a minute so she can kind of explain her background and her bio and tell us kind of, you know, how you got into this whole dental thing and, your story. And
Okay.
then I want to ask you a few questions about your company, Dental Coaches, and your new program called Crush the Call, which is super cool. And so I'm going to hand the time over to you and give us the goods. Who is Susan Leckowicz?
Hey, thank you, Adrian.
You're
Yes,
welcome.
I'm Susan Leckowitz. I'm from Newington, Connecticut. My company is called Dental Coaches, and I grew up with a very passionate dentist father who thought everyone should go into dentistry. And he encouraged me to become a hygienist, and I worked as a hygienist for 20 years at various practices around the country. And I really enjoyed coaching. I enjoyed having coaches, and I must have been coached by at least four or five different coaching companies over the course of my career. And I loved having an outside observer come in and challenge us, give us different processes and structures, help us grow, help us set goals, and kind of let us know what's happening in other practices around the country. And it inspired me to become a coach. One of the coaches approached me and said, I think you'd be a good coach." And I was really flattered. And a couple years later, I reached out to her, and her name is Dr. Victoria Peterson now. She was Vicki
Vicky.
McManus when I met her. And
Vicky.
we worked together with Bruce Baird for 9 years. I was a coach for Productive Dentist Academy.
Nice.
And yeah, it was a lot of fun. I learned a lot, traveled around the country a lot. And 7 years ago, I launched my own business and I called it Dental Coaches because I believe that one coach can't know everything that's happening in a dental practice. So
Not even you?
not
Not
even
even you.
not even superstar me. So I do a lot of networking and a lot of connecting with other people in the industry to find out what's the latest, what's happening. And I have a specialty team of coaches that work with our practices. And
Okay.
most recently, I developed a boot camp and I got inspired to do this boot camp because I was listening to recorded calls from my current coaching clients, and some of them had new team members, some of them had been trained years ago on how to answer the phone, and a lot of that training just kind of flew out the window. And
Got it.
I did a crush the stage boot camp in Florida with Dr.
Okay.
Delatoro McNeil that was very intense. I needed help with my presentation skills, and it was intense, but it was great. And I got inspired to create this Crush the Call new patient phone training boot camp so that we could create a concentrated training program for team members along with a format to train team leads on how to hold the team members accountable after
Okay.
the group is over. Because I found that one or two calls a month on phone training wasn't enough. So we developed a 90-day weekly program with a workbook and recorded calls.
So that's awesome. That's great. And that's this whole Crush the Call program was like really interesting to me because and one of the reasons why I wanted to do this webinar is because I came up in sales, telesales, and I just know how important it is to be able to handle a call. It doesn't matter if it's a sales call or a dental patient's the same thing. How to handle a call and make sure that you're able to lead the conversation to the end result that you're hoping to get, right? Um, and as a CEO of a company, as a marketing company, right? I mean, I've got my own sales team, and it's like if your sales team or the person that's answering the phone isn't like totally dialed in, you're out of business. Like you're literally out of business. And another reason why I was really interested in this is because, as a dental marketing company where we provide marketing services to a dentist, we can drive all this traffic to the website. We can get phone calls to come in. But if the person answering the phone is a doesn't know what they're doing, then the conversion just stops. It doesn't matter how much work we do, right?
Right.
The end result is, hey, you didn't do your job, even though it's the person answering the phone's job, right? So
Right.
that's one of the reasons why I was so excited to talk with you about this and actually encourage the viewers and our own clients and the people that follow us to seriously consider, getting involved with your program is because it's inevitably going to help us in a sense, right? So anyway, so that's great. That's awesome. So give me a little bit better, a longer overview or more detail
Sure.
about what's involved in the Crush the Call and what you're trying to accomplish.
Well, what we're really working on is inspiring team members to be the brand ambassador of the practice and
Okay.
really getting them to understand the patient journey. The patient Googles dentist near me, implants with my zip code, or
Okay.
whatever they're looking at. They look at a beautiful website, they read some amazing Google reviews, and they
Right.
pick up the phone. And many times in the offices will take their least experienced, newest team members and task them with answering the
Answer the
phone
phone call. Yeah.
without any training, out any specific training. And I think what they don't realize is how important that first impression is. They don't realize that the office is investing in marketing. They don't realize that patients call in upwards of 5 to 7 practices before making a decision. And
Even if
they
they're referred, even
yeah,
if they're
well,
referred to the
not
practice.
always if they're referred by a friend or family member, but if they're just looking and
Yeah.
Google searching, certainly if you're referred by someone, there's already that built-in trust,
Right.
right? But
Yeah.
I still believe that everyone needs a dentist. Everyone should like going to the dentist they choose, and patients are nervous and scared.
Yeah.
60% of Americans are scared. So when they pick up that phone, sometimes it's just a lot to pick up that phone. And if
Right.
that person doesn't make a connection or be empathetic or endorse the doctor and really get the patient excited about coming in, so they're
Mhm.
not tempted to go call the next person
Yeah.
on
Yeah.
the list and see what they say. And they have to really think about setting their office apart because it's very competitive in many markets. And that person, I think, might hang up the phone and go, let me try another one. And how do we set the office apart so that the patient shows up and comes in for the appointment and the patient, already has a good first impression? How do we
Yeah.
carry that through? And giving them the skills and the framework to do it, and how to control the call and how to guide the call and how to get the patient the appointment and then get them off the phone because we don't want them to have a 10-minute phone call and have the patient drag
Right.
them down bunny holes that they can't even answer, or how not to diagnose over the phone. There's so many things that can just go south on the phone, and the team members
Right.
are trying to help, but they just don't
They don't know how
know
to.
the
Yeah. There's no
skill.
where to go. Yeah. There's points where you give more information and where you hold back some information in order to continue to control the conversation and guide it. Um, I've got 4 kids. They're all millennials and Gen Zs, and uh, even trying to get them to make a phone call, that is like almost as difficult a job. But if they call a dental practice, like the amount of anxiety, like these people are weird. These kids are weird. Like they're all weird. But the
Yeah,
amount of anxiety that comes about in making that call, that if the person on the other end isn't super empathetic and can't make
right.
the conversation easy, it's a problem. And that's 48% of the population. Can you believe
Mhm.
that? That's how old I am.
Yeah,
48% of the population are millennial and Gen Z. Half
yeah,
don't
yeah.
know how to talk on the phone.
Hmm. Right,
I mean, there are a few.
right.
There are a few. But I
Yeah.
would say the majority of people have a really difficult time doing it.
Right. And there's a lot of power in having a checklist, a call slip, a framework, a process to go through, and then listening to the call and to be able to say, oh, there's where I could have inserted a positive value statement about the practice. Oh, there's where I should have grabbed the call and said this.
Right.
There's power in listening to it collaboratively with your other teammates, with coaches, and to be able to practice, right? We don't oftentimes do enough training and practice. And that's how we learn. from how, we
Well,
make.
so what you're saying is that the actual methodology is that you are pulling up a recorded phone call or several recorded
Mhm.
phone calls that
Yes.
have gone through in that week, and you're listening to those calls with the team members, and you're analyzing the call. You're giving probably some positive feedback, trying to find something good that they did, and then, by the way, here's a spot in the conversation where you could have said something different to control maybe the objection that's going to show up, right, or whatever it might be, and then you would give them direction on what they could say at that point, right? So you're
Mhm.
actually like breaking down, you're scripting, you're basically scripting calls. is that,
Mhm.
is that fair?
We
Okay.
are. We are.
That's the only way to learn how to do it.
Mhm. And I
You
know people hate scripts, right? Everybody hates a script, but we have a framework, we have recommendations, we have a way to say it. Everybody's going to put their own personality into it. We
yeah,
want them to be positive, we want them to be friendly, we want them to smile.
yeah,
And we have a four-step process that we go through first. So we want them to understand why we're doing this, why it's so important, why connection is important to people, and how dentistry is really a relationship business. It's not a transactional business. So how do they develop relationships on the phone with these patients? And our process is, and our scorecard goes through how do we show patients we care? How do we connect with them? How do we
right.
convince them to call the right place? How do we collaborate and work with their dental insurance plan? Whether we're a fee-for-service practice, whether we're a PPO practice, the conversations are very different
Oh
with
yeah, absolutely.
offices, and we customize how we handle when a patient asks, how much does a crown cost? How much does an implant cost? We have a process for that. And how to guide the call by, not feeling compelled to answer the question right away. If the first question comes out of the new patient, do you take Aetna? We don't have to answer that right away.
No, we don't. Click.
Right? Yeah, we're not a network. Boom.
Yeah, it's
We
over.
we can decide, okay, we're going to just sort of table that question. Oh, I'd be happy to explain how Aetna works we work with Aetna in our office. Can
Yeah.
I ask you a few questions first? What made you call us today?
Right, 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 right.
All of those things of creating that, why them,
Yeah,
why that
yeah,
office,
yeah, yeah.
and um, and how to handle the Medicaid question. How to handle the Medicaid question when
Right.
people call about that. There are ways to leave the door open to talk about payment plans, to text them a link to a third-party financing, to really say, if you
Yeah.
can't find someone, we can't work with that plan, but if you can't find someone to get you out of pain, please call us back. We could see you as early as, this afternoon. So how do you help people instead
You
of
know,
just saying,
you
well,
know,
they're on
you've
Medicaid, they're not going to come in.
yeah, you've brought up something that's really interesting. So, I used to do sales training, um, did it for years, and there was a rule that I always gave my reps, and the rule is whoever's asking the questions is in control of the conversation.
Right.
And so a lot of the skill set, I'm reading into what you're saying, and a lot of the skill set has to do with the uncomfortableness. So usually when you're in a conversation with somebody and they ask you a question, you feel obligated to answer the question in the way that however you've learned how to communicate, which is usually you just answer the question directly and whatnot. But in sales, and this is sales as much as you want to call it something other than sales, this is sales training. You have to be able to answer the question in a way, but retake and regain control of the conversation by asking a follow-up question. So, with the example that you just gave of, do you take Medicaid, right? If that's the question that's asked, you don't say, or do you take Aetna? That was the example. No, we're on a network with Aetna. Click. It's over. Conversation's over. Now, there are probably three or four other very, very easy ways to answer the question without saying no, and then ask a follow-up question to regain control and lead the conversation. And that is the toughest part of handling phone calls. It's just almost once you've learned how to do that tip, that trick, if you want, or
Mhm.
that skill, let's call it a skill. You can lead these conversations all the way to the end. The problem that I've found is that it's not easy. It's not easy to,
Right.
you have to be thinking two or three sentences or questions ahead of the game. Like you have to know where you want to go with the conversation and not be caught stuck on your heels,
Mhm.
getting just lambasted with questions, and then they just hang up on you. You know what I mean? So that's what you're teaching? Is that
Mhm.
fair? Is that
Yeah.
you're
Yeah.
giving them
Big
the
part of it.
responses and
Yes.
walking? Yeah, okay.
And
I
the
love it. That's
example.
awesome. That's exactly what they need.
Yeah, and we kind of have this phrase, AWE. So, and I challenge them, think, and what else? What else is going on with this patient? It's not just they don't know what else to ask
Yeah,
except you take my insurance. They don't understand how dental insurance works. I
right.
listened to a call where we're coaching a team in New Hampshire and the patient's saying, well, I've got insurance in Pennsylvania from my old job and nobody, I'm calling other offices. They don't seem to take it. Well, guess what? Maybe nobody in New Hampshire takes that insurance. She's never going to find someone that
Right.
takes
So
that. That
why kill the
plan,
conversation? Yeah.
So just getting them to think differently and how do we create a system where we have a call slip that is easy for them to reference and easy for, we suggest that they take this call slip and they print it in a different color piece of paper so that if another team member goes by, they can see, okay, this person's on the phone with a new patient. I can't interrupt her. I can't have her greet a patient at the front desk because you got to focus on this. And sometimes it's just a matter of slowing down
Yeah.
and becoming a better listener
Yeah.
and not really think of it as an intake, just really thinking about what's going on with these patients.
Yeah.
Sometimes I
Yeah.
hear calls, a patient will say, oh, I've got a terrible toothache. I've been up all night. And the team member says, what's your email? Like,
You missed it. You
I'm
missed it
like,
there, guy.
oh, oh,
Yeah.
oh, oh. So,
So let me ask you this. Like, it all
okay.
sounds great, but like, what's the benefit? Like, what, obviously this has to do with converting more
Yes.
calls to scheduled patients,
Right.
right?
Right.
I mean, you're going to get a lot of calls that aren't about new patients. They're just going to be about existing patients asking questions that you need to handle in a better way. But
Mhm.
what are we talking about in terms of like productivity, profitability? Do you have an example of like a
Sure.
practice that,
Mhm.
you know, was only converting here, but through the training they got to here and what that means in terms of a dollar amount? Do you have
Mhm.
some information about that?
I do. I do. So most practices, when we look at call conversion, many times they're starting anywhere from like 25 to 40% of the calls are getting converted. So we look at each practice individually and we say, how can we get closer to 70%
Hold
conversion
on,
rate?
hold on, hold on, hold on. You're telling me that 25 to 40% of the calls that come through, they're converting to scheduled appointments? That's
Yes?
super high.
You think that's high?
Well, are you talking about just like new patients, or are you talking about
Yeah,
every
new
single
patients.
call?
No,
Oh,
I'm
gotcha.
just talking
So this
about,
is just new patient phone calls.
yeah, just new patient
Got
phone
it.
call.
Okay.
Just new patient
No,
phone
okay,
call.
that makes sense. I was
Okay.
gonna
So
say like every single phone call coming
right.
in, you're converting a third of them. That would be amazing. But if you're just talking about new patient
New
phone calls,
patients,
yes.
right.
Okay,
New
gotcha.
patients. How many new patients get booked?
Okay,
So
gotcha.
we're working with a large practice, okay, multi-doctor practice.
Okay.
They, before we started coaching them, they had 106 new patients and they converted 45% of the calls that came in. Within 1 month, they jumped up to a 64% conversion rate and they had 144 new patients and they had a
Wow.
10% increase in their collections. They collect over 500,000 a month. So, you know,
So wait, they went from how many to how many again? Sorry.
106 to 144. So
That's
106
like
new
a
patients, 144. No, we also coach them on the other processes of converting case agreement and all that. But, you know, if many of the offices we're working, if we can just get them in the door, that's
yeah.
the hardest part. Get them in the door, and then we'll, look at converting them.
Is that
So,
typical? Is it typical to see almost a 40%, 40% increase?
well, you know what? This team got really jazzed up about it. They were incentivized, and I think they almost even looked at it as a little game. How can
They
I
gamified it. I like that.
Get this person in the door,
Okay.
right? And I shared with them, I want you to think about trying to become friends with this person on the phone. You're
Mm,
trying to, become friends with them, get them connected to you, the practice, get them in and help them. I mean, people need help. They're calling because they need help. And so we always look at where are we starting with our call conversion? How many new patients do we have currently? What's our new patient goal? I work with some large offices. That's a large office. I work with a smaller office. This is a solo fee-for-service doctor, open 3.5 days a week. He's doing 2 million a year. And he says, well, I just need 25 new patients a month. That's all I can handle.
yeah.
It's all I want, he went from a 32% conversion to a 67%
You double.
conversion. Yeah. So,
You know what's
um,
amazing to me is like there's that much opportunity that's being missed. That's like
right.
like holy cow, like when you talk about like marketing, right? And we're talking about driving traffic to say a website and we're trying to get them to fill out a form. If we can get them to go from 2% conversion to 3% conversion, like 1%, right? It's a
Hmm.
big deal. You're talking about a lot of new patients. Like I can't believe
Hmm.
that there's
Yeah.
that many new patients calling in that are not scheduling because the call's not handled right. That's just unbelievable to me.
Well, you know, I who knows why they're not scheduling, right? Not who knows, but whenever we listen to calls, and in my 16 years of experience as a
Yeah,
coach, I can honestly say I've never coached an office where they said they don't need any help at all on the phones. They're amazing on the phones. They're
yeah,
doing
yeah,
everything right. There's nothing I can do to help them improve
yeah.
with their phone skills. It just rarely happens.
Rarely
And
is the case. Yeah,
yeah, and I think the team member also thinks, well, I got them scheduled. They scheduled. Now, did they keep the appointment? So
yeah.
we like to track the success. Okay, you got them in the book, but a bunch
Did
of
they
them
show
scheduled.
up?
So one of the things we discovered with one of our clients was they were doing better at scheduling the patients, but then when we went to track, did the patient come in? What did the patient have done? They were canceling. And I'm like, well, why did they cancel? We don't know. And so we started to kind of unpeel the onion a little bit and say, well, okay, they're getting the paperwork from online to fill out ahead of time. We're asking them to do
Okay,
that, to confirm your appointment, fill the paperwork out. We're getting the paperwork. So unbeknownst to us and the doctor, the team had created an FAQ sheet that was going out to the patient
okay.
because they wanted the patient to know all these different things about their policies and the tone, the negative tone, and just
Yeah.
another first impression, of the practice. People were getting really turned off and
Were they
can't.
saying something like you have to read through this FAQs and sign it
Yeah,
before you come in or something?
right. Or this is what you have to pay when you come in, and you can't do
Oh
this
yeah,
and
they're just trying to
that,
like.
you can't do this and you can't do that, and yeah. So
So you
I
got
was
rid of
like.
that.
So we suspended that. We said, okay, let's think about, how we can have a relationship. This is how things work in our office,
Yeah,
rather than give them a piece of paper to read and have them go, I
yeah,
don't,
yeah, yeah,
this is turning me off, So it's things like that, or just even learning new people don't remember that we have payment plans in the office and they put somebody on hold for 10
yeah,
minutes and hangs up. Well, okay. So there are a lot of things you can learn. It can be painful to listen to calls, but there are a lot of things you can learn, other things than, just even the new patient
yeah. You
phone
mentioned
call.
an incentive earlier.
Hmm?
So when you set this up, you're trying to get everybody jazzed about it and excited. Nobody wants to go through the training like what you did when you were in the office, but you're a
Yeah, and we
unicorn.
we make it fun. We make it fun. We try to, you know, I I think the teams support each other. They'll support each other,
Yeah.
and we have them critique each other, and we do a lot of simulating, and we have a scorecard. So we have a 5-point scorecard,
Okay.
and we ask that they hit 4 out of the 5 points. Okay, even if the patient doesn't schedule that they, do the greeting, they grab the patient's name and use it a couple times in conversation. They smile,
Yeah.
the tone of their voice is right. They create some kind of positive statement. They endorse the practice. They, explain things correctly, like how their insurance will work in the office, what to
Yeah.
expect at the first visit, all of those things. So if we can choose we choose 5 random calls in a month, and if they can score an 80%, so 4 out of 5 on our scorecard, and they do that 80% on 4 out of 5 calls, they get a
You
bonus.
get a bone. Okay.
Yeah, and
What's it
depending,
like? What's a decent incentive?
I don't know, $50 gift card,
Okay.
something
Yeah.
like that, $25 gift card, $50 gift card, something, and sometimes it's not even about the money, right? It's more about the competition. Like I like a little
Yeah.
competition, more about, wanting to do a job, but it is nice to be recognized and that's how they learn from each other too.
Yeah. Yeah.
We can kind of spotlight someone who's doing a good job and just say what she says, or do what
Yeah.
do what he's doing on the phone and it works well.
Yeah, we've done social media marketing campaigns for thousands of dental practices, and like one of the campaigns that we do is to help get more Google reviews, right? And you can talk to a doctor and you can get them excited about, or a team, right? And you get them excited about getting more Google reviews or handling the phone call better or whatever it might be. And people get jazzed and they're like super excited for like 36 hours. And then it's like everything like just comes back to normal. They got all their regular junk they got to deal with and they forget about it, right?
Hmm.
So creating an incentive, a timeline and a goal and an incentive was the way that we figured out how to get dental teams to actually take action on a particular marketing effort. So, to hear you say that you've implemented an incentive program or you encourage an incentive program is probably almost vital to getting this set up and having them, actively work on it. How do you keep them sticking to the plan though? Like you're going to lose an employee that you've trained, a new one's going to come in, or you're going to listen to the calls in 9 months or something like that, and they're not going to be using any of the scorecard or like how do you like keep them on point? You know?
Well, that's where we work really strongly with a team lead on the call, to be the
Okay.
one who's going to be weekly logging in,
Oh, so
listening to
there's somebody's got a
Glory call.
responsibility.
Somebody's got to be responsible on the team. Now, if they
Okay.
want to hire my team to do it, my team can do it. But it's almost like you have to trust they're doing it, but you have to verify too,
Right.
right? And in
Right.
the beginning,
Absolutely.
there's more verifying, right? You're trusting, but there's more verifying. So I'll tell you a
Right.
story. There was one practice we had where we create a workbook and team was like, oh yeah, 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 we're gonna do this, we're gonna do this, we're gonna do
Yeah.
this. I find out later that, one of the gals on the team wrote on her workbook, I'm not doing this to her buddy else. Okay.
That's awesome.
And the office manager happened to see that little note go by and pulled her aside and said, gee, what's that all about? And oh, I was just kidding. I was just kidding.
Yeah, it's not all kidding.
Um,
There's
so
always some truth to it.
in the beginning, when we do our training, we tell them, okay, we're gonna log in and listen tomorrow. So in between these weekly trainings, we're logging in and listening. Okay,
Got it.
my team
Yeah.
is. So I sent a little message to the office manager. Mary Jane is
Isn't
not doing
is
it.
yeah. Yeah, right.
Not doing it, and we really felt she was very capable when we're doing the simulation. She sounded great.
Yeah. Yeah.
I'm like, you've got to kind of look into this. So she, asked her about it. So then for a couple weeks, she did kind of straighten up and do it.
Yeah. Okay.
But then she quit. And guess what? The office had been planning on letting her go for a while. And
So they let her go?
well, she quit. She kind of self-selected out.
Oh, she
I'm
did.
doing
Okay.
this. And if you've got that kind of toxic, kind of negative, I'm not doing this type of person on the team,
Yeah, it's not even her company, man.
yeah, it's
Think
just
about it.
better. It's just better, I think, to I know it's competitive out there, but they got a new person in there who's very energetic. It's like a
Yeah,
fresh
it's
breath of
willing to
fresh air,
be
energy
flexible and
lifted. Yeah.
change. Yeah.
Um, whenever you do any kind of coaching, you start shining like the bright light of scrutiny, right? And some people love it. Like,
Yeah,
ooh,
yeah, yeah, yeah.
some
Yeah.
people are like,
Well,
uh,
one of the toughest things that I mean, when I did sales training, we did it the same way you're doing it, which is great. I mean, it's like you pull up a call, you listen to the call, everybody's in the room, you try and find something positive that you can explain back to them, say, you did great here, you did great here, you did great here. Here's where we need to focus on. Anyway, when you're in the hot seat, when it's your call they're listening to, that is an incredibly uncomfortable place to be. But the uncomfortableness of it actually is what's helpful in helping somebody to break out of a model that they might, a conversational model that they might be set in. So once you're willing to do that, if an employee is unwilling to go through that process, they're unwilling to change.
mhm,
They're too uncomfortable, it's too painful, it's too scary. And if things are too painful, too uncomfortable, and too scary that they can't even make small changes, then hopefully they do self-select and move on because you need people that are going to be willing to adapt, right? Be
right.
willing to like put, be in the hot seat, so to speak,
Mhm.
you
And
know?
what we find with this program is that it's kind of a progressive build, right? They get used to saying something, oh, we're going to take great care of you. Okay, that's a good saying. Now we're going to say, our doctors does a lot of dental implants. They've had extensive training. I've been working with Dr. Leffler for 10 years. He's amazing. You're
Yeah,
going to love it here. Like they get it, and they go, okay, well, what could I say? Or what, how can I kind of boost this up? So in the beginning, when we're scoring calls, we're pretty, we're pretty flexible. We're pretty lenient. We don't come down hard on the team
yeah.
members, but we are clear on what we want them to do, um, and we help them overcome obstacles. If there's an obstacle, how do you overcome it? And we'll play calls from other offices. Okay, let's hear how they explain the cost of a crown in Maryland. Okay, let's hear how they're doing it in Texas. Let's hear how they're doing the greeting over here in
Is
Ohio.
it very different in those areas? Is like,
No, but sometimes it's good to hear different people. Like they'll say, "Oh, I like the way she said that." It's just
okay,
not focused on just them, right? Just sort of the
right,
concept of, well, what are other people saying? It's all the same process that we coach, but there might just be a different spin on it or a different cadence to their voice, or it's just a way to get them to kind of open their mind that other people are doing this, and
right, right.
successful.
Yeah, well, it's always you always want to have like a couple, two or three different ways to respond to a particular objection or cost concern or the Medicaid or insurance question. You always need to like it can't be the same response every time. You have to be able to kind of bounce around a little bit. Okay, tell me, how long is the program? How
So
many months is it or weeks?
it's 90 days, so it's three
Okay,
months. It's weekly 45-minute Zoom trainings. It's all done virtually on Zoom. They're recorded so that if you get a new team member, if you want someone misses a call, if someone wants to go back and review a concept, so you get to keep the recordings. We have a fill in the blank workbook that goes along with it.
okay,
And we train the team lead or leads
okay.
how to keep the program going, how to keep continually scoring the calls, once a week, logging in, listening to calls, meeting with the team, scoring calls, paying attention to that.
So I
So,
have a question that came through. So you're not, this is all done online. You're not flying
yeah,
out to the practice.
no, we're not in person. It's all done online. Our request is that we have visual cameras on to see the team members, and they're not like on a cell phone, right? That we've
Got it.
either got a laptop or like a big break room screen.
Yeah,
We can deliver it in a one-to-many setting. So if it's, a two-location practice, but we want to have a consistent, day and
yeah,
time
yeah.
where we're eat. And we want to be able to get to know the team members, be able to really listen to different people's calls. We're not going to single out just one or two people. We're going to,
Yeah,
and we're going to have a before call and an after call, and we're going to share
right.
that, with them. So this is where you started. This is where you are. Because sometimes people aren't really good at looking back, right? And celebrating where they've come or how far they've
Oh,
come
right. Yeah,
and
yeah. That's
developed.
good.
because they
That's
might be
really
like,
good.
oh, I'm still not doing this right. I'm like, well, here's before, here's where we are now. So, um,
So I think to the question of whether or not you're flying out to the practice and doing this face to face versus online, I
mhm,
would I would probably, to a potential concern that question might be, is like, is the training better in person or is it better online or vice versa? And I would say from my experience, the type of training that we're doing is this is telesales training. This is
mhm,
basically phone training. It's a listening skill. You don't need a coach. You don't need Susan to fly out and stand in front of you to teach you listening skills. It
mhm,
could What you need to learn is can be translated through a Zoom or some kind of a Google Meet or whatnot.
um,
So and it brings the cost down. Then you don't have to pay
right,
for Susan to fly her team somewhere and
right,
put her up in a
right.
hotel and buy a
And it
really,
can't be
really,
like a
really
one
nice
and
suit.
done, right? Or a 2 day
It
thing. It
has to be, it has to be repetitive.
has to be
It has
repetitive.
to be repetitive.
And to really kind of follow up, okay, what's been working this past week? What hasn't been
Yeah,
working?
yeah, yeah, yeah.
That's the most important thing. We do in-office trainings with our full coaching programs, but I'll tell you, a lot of times we're in office maybe twice a year. We do a lot virtually online.
Yeah,
It's not exactly the same, but there's a lot you can do virtually
yeah.
uh,
I
these days,
agree.
in my opinion.
I agree. There's only a small added benefit to being in front of somebody when you're talking about this kind of stuff. I really feel like you get 95% uh, through, where really the issue is people are hiring you because you've had a couple decades of experience in actually doing it, and you have some success stories, several of them apparently, and um, you're basically, handling dental phone calls is such a highly specific skill, right? It's just not just general sales training. It's like you have to finesse the call in a way. You have to have the right type of information. And I would imagine that like there's probably 20, maybe 30 typical calls that come through. And once you figure out how to like manage those calls, you
Yep.
like cover your bases, right?
Mhm.
It's probably a lot of repetition, some memory, remembering what to
Yep.
ask, and
And sometimes it's say less and say it well. They get nervous and they start rambling on and I'm like, oof, too much. Like
yeah, yeah,
we
yeah,
can we can tighten this up so that you're really succinct and clear, with the patient and
yeah,
not trying to, you know, answer all these questions or make a lot of assumptions, on the phone.
yeah, yeah,
That, in the team's defense, they're trying to help. They're trying to help. They're hearing a question. They're trying to help. But, even an experienced dentist can't diagnose something over the phone,
you're
and
right.
I've got people sending people to the emergency room, sending them here, I'm like, what are you doing?
What are you doing? What are you doing?
Your job is to get them in the door. Get them in the door.
Yeah, don't try and don't kill it
Yeah.
from the beginning. You mentioned the scorecard. That's the scorecard you sent me. What I'd like
Yes.
to do is, and I'm going to send this video recording out to everybody that's registered and attended. I'm going to include the scorecard if it's okay that they can have that.
Yes.
Would that be
Please
cool?
do. They can
And
have this
then,
scorecard.
okay. And then you told me that you'd offer a free consultation.
Yes. Be
So,
happy to do.
all right. So I'm going to share a QR code really quick for those of you that um, are on your desktop. If you want to shoot that with your phone, you can schedule a free consultation with Susan. What is it?
Yes.
A
Or
half an
yep,
hour
30
ish?
minute. Yep. 30
Okay.
minute consultation. Talk about
Okay.
your team and how we might be able to help you. And my website is dentalcoaches.com. There's a link in my
Great,
website.
great URL, by the way.
I
Like,
just
I
got
can't
lucky.
believe that that was even available when you set up your business.
2016. And I think I
Well, how did
was
that happen?
kind of like starting my own little business that I was like, oh, I like this one. Like
Yeah,
I
you just stepped into
power.
Like the the search phrase that anybody's going to search is dental coach. You
Yeah,
know, I'm
yeah,
surprised that didn't get bought up by one of the other
yeah.
30 or 40 coaching companies in the country that's been doing this for 50 years, you know.
I don't know. Somebody was looking out for me there, man. I
So
just got lucky.
dentalcoaches.com.
Coaches.com. Susan at
Okay.
dentalcoaches.com is my email.
Okay.
So we have some resources on our website. Sign up for our newsletter. We'd love to, keep in touch. So, we're really excited about our Crush the Call new patient phone training boot camp, but we also do full practice management coaching as well.
Awesome. All
Okay. Well,
right.
thank
So
you.
everybody out there, take advantage of this. Get 30 minutes of Susan's time. See if she might have some suggestions on how to improve your profitability of your practice. And if it's anywhere close to what you've mentioned, like being able to get 30 or 40 new, converting 30 or 40 new patients a month, like I can't even believe that. That's unbelievable.
Yeah,
So I would encourage you to take advantage of it. Um, and then I will send out all the information here, and I'll encourage Susan, if you don't mind following up with everybody, that would be great.
sure. Be
Is there
happy
anything
to.
else you want to mention before we jump off?
No, no, I would just say listen to your calls, take my scorecard, score your calls, see how your team's
I love it.
doing. That'll be a good first step.
Thank you. It was a pleasure having you, Susan.
Yeah, it was my pleasure being
Okay.
here.
Take care.
Thanks.
See ya.
Okay, bye.
Bye.